Hello friends, you must have seen people with nosebleeds or what we call it as epistaxis or bleeding from the nostrils. Some people are really disturbed by this and noted from early childhood. Most of the time it comes under the purview of the ENT surgeons, but sometimes the cause may be different and this may be only the tip of the iceberg. There is one particular condition called a hereditary hemorrhagic telangiectasia or Osler-Rendu-Weber syndrome. This can manifest as early childhood nasal bleeds, which tends to recur, means it comes on and off. Sometimes they can be associated telangiectasia or small skin discoloration on the lips and the tongue, the palate. Sometimes it can be in the upper and lower respiratory tract, which can present with the bleeding from the nostril, bleeding or coughing out blood. Sometimes there is one condition called a pulmonary AV fistula, they can have AV malformation that can come with the breathlessness, clubbing, cyanosis, hemoptysis, coughing out blood, breathing difficulty, cardiac failure, pulmonary hypertension, and many complications related to that. Sometimes they can also have AV malformation involve the brain, which can present the intrapharyngeal bleed, subarachnoid bleed, cardiac failure, or more chance to have brain abscess and other infections. So these are one another aspect of the so-called hereditary hemorrhagic telangiectasia. So they can have upper and lower GI bleed. They can present with the anemia. When you do endoscopy, you could see the telangiectatic vessels in the esophagus, in the stomach, in the intestine, as well as in the colon. They can present chronically with the anemia. Similarly, they can have subtle cosmetic disfigurement in the face, the lips, and cheek, and all, which are amenably treatable with ENT, with the dermatologist, with the laser surgery and other procedures. And sometimes they can involve the spinal cord, giving rise to AV malformation or AV fistula of the spinal cord. So my point is that a nosebleed may not be real nosebleed. A nosebleed may be a epiphenomena of a major disease called hereditary hemorrhagic telangiectasia or Osler-Rendu-Weber syndrome. This has been reported in the US, 1 in 5,000 1 in 10,000. There are 5 mutations for this particular condition. And when there is a family history of nasal bleed or nasal bleed occurring repeatedly, or when there are multiple areas like the small spot-like reddish spot-like thing like called telangiectasia over the lips, over the tongue, or the palate, or over the nose, or the nail, or or the ear lobule, and if they present with multiple areas of involvement like the brain involvement, the skin involvement, the mucosal involvement, liver involvement, spinal cord involvement, lung involvement, always be careful. This may be a condition which are treatable. There are multiple levels of treatment. One is a cosmetic if there is a skin alone is affected, and if there is a nosebleed alone, of course you can the ENT surgeons are good enough to treat all those conditions. They can pack it, they can cautery it, and sometimes they can do a surgery. But if it is recurrent and it is not amenable to treatment by this means, then we have one more condition called targeted embolization. You take a catheter into the femoral artery and take the catheter into the external carotid artery. You cannulate the branches of the external carotid artery, especially the middle, the MMA or the maxillary artery, IMA, the maxillary artery, this phenopalatal branches or the nasal branches by super selective catheterization, and give a PVA particle, polyvinyl alcohol particle, into that area. Okay, and it's my professor Dr. Shakir says that this is one of the finest things you should be careful enough. It is not just a cakewalk as we think. But sometimes you have to cannulate the ophthalmic artery, you have to cannulate the facial artery, you have to cannulate the internal mammary artery, and we have to have a selected targeted embolization. Okay. One of my teacher from Japan, Masaki Komiyama, he says that he is one of the authority in the world on hereditary hemorrhagic telangiectasia. He has got innumerable collections of this particular condition where he treat the brain AVM, the pulmonary AVM, pulmonary AV fistula, as well as the various condition related to this the spinal cord, the liver, the brain, the spinal cord, and the skin, and with this prominent epistaxis. So he says that last week we had a meeting, so Delhi course, where he explicitly explained all the nuances and treatment aspects of this particular condition. And I really, thankful to him, because he told me that he would share some interesting slide on this particular condition that I think I will be able to share in this particular presentation. So, okay, so if you have any doubt on these particular clinical aspects, the treatment, or any other doubts or questions or queries, you are welcome to do so. Okay, thank you very much. Bye.